today in the continuing journey of our 40 years of trying to implement a national health insurance program in this country. In April 2017, we implemented the primary care program. Now, the intent of a primary care program is to guarantee a first point of entry into the healthcare system with a personal physician, not only to provide the essential care as needed, but also on a long-term and an ongoing basis. It is a focus on community-based care. Now, while this is important, Bahamians have placed equal or greater emphasis on the need for hospitalized care and how to pay for it. Many can't afford it. The health insurance premiums are too high. They have lost their jobs, and they can't afford to buy or maintain it, nor do they have the cash to pay for care. For many, it has wiped out their savings, or they have to take out a loan or mortgage their homes. Most resort to cookouts. Too many just do without the care. They suffer, and unfortunately, God forbid, some pass away. Today, we announce another advance on the journey to universal health coverage. First, an expansion of the primary care program, and secondly, for Bahamians to have access to the most expensive and high-cost care, hospitalized care, without the fear of financial hardship. Contrary to the belief of some, we continued the primary care program. Since the launch of National Health Insurance Bahamas in April 2017, over 40,000 beneficiaries have enrolled in the program today. We have engaged over 80 providers, including labs, providing access to Nassau, Freeport, Exuma, and others. And on a recent survey of over 3,000 enrollees, 95% are satisfied with the care that they have received from their providers. The new National Health Insurance Program proposes to expand primary care and to include cancer screening program and its diagnostic testing. The new benefits will include comprehensive cancer screening for the most common cancers in the Bahamas, many of which are easily treated with the appropriate care. Indeed, an ounce of prevention is worth a pound of cure. The new diagnostic imaging services will include various x-rays and ultrasounds, such as prenatal ultrasound. The impact of this expanded primary care program will be to make preventive care accessible and affordable to all Bahamians. Concurrently with the National Health Insurance Program, a national wellness program will be rolled out, which will include initiatives aimed at improving the health of the population over time. The program will focus on prevention, health education, health promotion, and an outreach program that we propose to be funded through taxation of certain unhealthy products, such as sugar-sweetened beverages. The immediate question in proposing a national health insurance plan is how much will this cost us? We took the Bahamian approach. Never hang your basket higher than you can reach. Yeah. So instead, we asked the question, what could we afford? We propose to implement an essential package of benefits, a high-cost care program to include comprehensive coverage for select conditions or treatment, all of which have a high prevalence in the Bahamas, namely breast cancer and cervical cancer in women, prostate cancer in men, colon cancer and rectal cancer that occurs in both. With attention to our high prevalence of diseases of the heart and the blood vessels, we focus on heart attacks and its related ischemic heart disease problems. And we also included pacemakers when the heart beats irregularly and death is impending. And finally, we include the caring for those with end-stage kidney disease, not only to better their dialysis care, but to include the scope and the hope for a kidney transplant. These proposed changes and funding of national health insurance are grounded in our Christian values. We are our brother's keeper. It is for what we do for the least among us. It is one of shared responsibility, fairness, commitment to the community, and working forward, upward, and onward as a people to achieve the triple aim of healthcare, to better the patient experience, to improve the health of the population, and to give us the best value for the money we have. So today, the National Health Insurance Authority is releasing a policy paper entitled National Health Insurance, a Shared Responsibility. It outlines the proposed policy framework to transform our healthcare system. Under the new proposal, NHI promises to be affordable, realistic, and sustainable, with a goal as a catalyst for change in the way Bahamians experience healthcare and the providers deliver. We have advanced the primary care model to encompass an essential package of services grounded in sustainability. The new model shares responsibility, access, accountability, quality, and fairness, all while staying firm to a commitment of improving the ways patients experience care. We propose a shared financial responsibility between employers and employees, the citizens and the government, the insurance providers and the health providers, the public health sector services and the private health services. In so doing, quality healthcare services will be made accessible for all Bahamians in a way that is affordable and fair. By making funding for national health insurance more reasonable and sustainable, this will allow for national health insurance to continue to expand its benefits being covered over time. Starting today, the National Health Insurance is launching a 45-day consultation period with stakeholders and the public to discuss proposed changes to the program to get their feedback. The National Health Insurance Authority will be scheduling individual meetings with stakeholder groups and will be hosting town hall meetings in New Providence, Grand Bahama, and the Family Islands during this consultation period. Stakeholders and members of the public can also submit their responses through an online consultation survey, which is being released today as well. We welcome everyone's feedback and look forward to hearing the perspectives of Bahamians on this important national health program. I want to assure you that this is not an announcement of implementation, but a proposal for a new way forward for national health insurance in which we seek to engage the public and all participants and providers of our healthcare system to make their input so that together we design a national health insurance program that we can serve and can serve our generations to come. At the end of the consultation period, the National Health Insurance Authority will then present recommendations to the government of the Bahamas on the way forward for national health insurance in the Bahamas. I thank you, and I'll answer as many questions that my time allows me.
You were, I guess, alluded to it earlier, but
Can you speak a little louder?
Oh, sorry. Francesca Ryan from Eyewitness News. You kind of alluded to it earlier, but there really was no answer to the question, how much is this expected to cost?
Well, I think the way I think the humans want to know is how much this is going to cost me. What's coming out of my pocket? So we're very prudent in this. We have, from our calculations, we're looking at Bahamians who earn at least what we consider the general average salary in this country. They will pay no more than $42 per month. So if you were to look inside our proposal, you will see a list of what would be expected that everyone would be required to pay.
Vanilla Gilbert from the Bahamas Education Services. Towards the end, you spoke about this is a proposal and not implementation.
Absolutely.
Could you explain that?
Yeah. Well, first of all, I don't think that we are that presumptuous that a group of us sitting around the table can decide what the Bahamas wants. When you're looking at national health insurance, and particularly when we consider that this is a shared responsibility that everyone has to carry, then it's important we can, all we set out to do was to design a framework that we felt was affordable and sustainable. And now we go to the Bahamian public and we say, now, what would you like to put on the frame? What are the glasses, the doors, etc. and stuff like that? We might have some who decide we don't like your frame at all. And so with that in mind, we then will go back to the cabinet and we would say to them, what do you think? We have made presentations to the cabinet. They have, I can't say that they're fully supported, but they have encouraged us to continue in the path in which we go.
You have something here called risk equalization. Does this mean that if I have a pre-existing illness or that I would end up paying more than, I guess, somebody else who may be a little bit more healthier than I am?
Thank you, that's a very important question. Okay? The problem we have in healthcare today is experience-based care. So in other words, the sicker you are, the other conditions you have, the more you pay. The essence of a national health insurance program, what we have designed, is that no one will be excluded on the basis of their current needs. No one will be charged more on the basis of their current needs. So it is a shared responsibility. And so for those who have pre-existing conditions and so forth, on joining or enrolling in the National Health Insurance Plan, for those conditions that we have outlined so far, including primary care, that whatever is in our resources to provide you with the best care you have, we can provide. So, for example, when you come into the hospital and you enroll in a National Health Insurance Plan, the doctor says, these are the drugs you need to have, I don't expect you to be laying in bed waiting for someone to come and bring some couple of dollars for you. I don't expect someone to come and bring some couple of dollars for you to pay for an MRI scan. Or if you have ischemic heart disease and you need an angioplasty, that you need to wait in bed for someone or to go to get a loan for you to have. So we are all sharing in this cost. And that's what it's about.
I know you mentioned, the first question was how much it would cost Bahamians. You said $42 for those earning, I guess, the average salary. What would you say to those who may say that's simply too much, that's unaffordable, because it seems like it would be an income tax?
Well, there are two ways to look at that. I just wanted to bear with me a minute. Get something here that I can look at some facts. One of the problems, a major problem in our healthcare system, is we lack equity. Those who need care can't get it. Those who need more care can't get that. They just don't have the money. And one of the things that we have in individuals who work in a place, you find very few places actually pay for health insurance for individuals who make our minimum wage. So what we are looking at is that even individuals who make minimum wage will make a contribution. But in those instances, we expect the employer to pay a little bit more for them. So those who have minimum wage, as you will see in your proposal, they are expected to pay. So they're getting $10,000 a year. We expect them to pay $17 a month towards their health insurance. Now that's the cost of less than 4 clinics, depending where you go to buy. Okay? So, instrumental in what we are doing is that we have attempted to make this affordable for everyone across the board. And if you are above $25,000, which is the basic, you will still, the maximum we'll collect from you is $42.
The question is there any other models apart from the contributory model that we have currently?
Yeah, there are many models.
Is this what's being implemented? Or this is what the NHI is recommended to the government to do, to have a contributory policy across the board?
There are many models in funding healthcare. There are basically 4 models. The hybrids, but there are basically 4. You can go with the British system, which is a total public system. So the government pays for it. The government owns the facilities and pays the providers. They pay a nice income tax, quite high. You can go to the Canadian system, which the government again funds it. And because those provided privately. Primarily, again, is income tax. Now, the next system is what the Germans have. And they have what is called social insurance. And that essentially is where we have salary deductions. Now, that seems to be the one that is probably the most to apply to us. So that's why we've chosen. Because the fourth one is out-of-pocket payments, and we can't pay for that now. So when we look at the systems, we look at the ones that meet our current funding mechanism, number one. And number two, more importantly, we have to look and see what it is that we can afford.
Is it that those who participate in the plan are the only ones who contribute? Or will everyone contribute regardless of participating in NHI or not?
Another good question. Everyone will be contributing. Some will pay directly, the other half the government will pay. So what we're looking at is what is called an employer mandate. Everyone who is employed will be expected to have salary reductions. Now, we also cognizant of costs for employees. So first of all, we don't expect this plan to be implemented until for at least another year. Secondly, we are looking for those companies that have at least 100 employees, okay, that we think might have the capacity to carry the load. Those that have less, we will expect for them to make a small contribution for each of their employees. And for those individuals who are not employed, then we would expect that when they go to the government healthcare services, that they will enroll in the same way they are enrolled now in our primary care services, that in order to get these benefits, as senior citizens, retirees, other children, unemployed, but they would be carried by the system. It's a part of the shared responsibility. So it is in our best interest then to get the economy going quite well, such that everyone, as many people as possible, are employed. But more importantly, I think that as we spread the risks across the population, that everyone who is working is employed, I would expect that it would drop the premiums significantly. And so therefore we can have more affordable premiums, that there are those who would prefer to have private care, and such that again that would take more of the burden of the public system.
Is any portion of this fee going toward, I guess, readying or assisting the government in getting the public health facilities up to par? Because we know the state of public health facilities at this time.
This is our greatest concern. Will the public facility meet the standards that the people expect to have when they started to pay? Well, the first thing I can tell you, working inside the public system for almost 40 years now, okay, that as they say in Shakespeare, the good is often told in their bones. People always know about the bad things that happen in the Princess Lighthouse. But really, or what happens in Iraq. They never tell you about the thousands and thousands of good care that's there. We intend to better that care. We intend to minimize as much as possible the level of care that we consider not to be safe care. Because we want to have our system to be entrenched in quality. We are looking at national health insurance would be a catalyst for reforming the way doctors are paid, the hospital is paid, okay, and how the hospital collects its money. Because for practical purposes, if each person who is not employed, as all people are employed, and each person that is not employed that comes under the banner of the government, then every resident legally in this country becomes a private patient. So in other words, the healthcare system, the public healthcare system, can bill for the services, prepaid.
Based on the model that you gave, I believe you said if you earn $10,000 a year, your contribution would be approximately $17 a month.
17,
yes. That works out to be about 2%.
Yes.
So is it staggered? So we call it contribution, but it's really a tax.
Yes.
The tax is 2% of salary. Is that correct?
You can call it a tax if you want to, but
It is a tax.
Yeah, but like, it's a difference. You consider if you have health insurance premium, you consider that a tax. When you pay for your health care, you consider that a tax.
That's not answering the question.
No, but I'm asking, yeah, because that's the way I'm viewing your question.
Is it 2% contribution or tax?
Yes.
That's staggered.
It's whether you look at the
On
company
salary.
in half empty or half full.
We're going to take one more question. We've already got quite a few
We can take,
questions,
yeah.
so we'll take one more.
So once I pay this $45 or $70 or whatever it is that I pay, what, just for clarification, what exactly does that cover?
I think that you're missing two things. The first is that if you have your current private insurance, you will not have to make any extra contribution to national health insurance. You are covered. The basics, the standard basic package that we have will be covered in all the comprehensive insurance plans that exist now. So that's the reason why I was saying in his particular instance that they're not taxing you. What will happen is that your contribution of your current premium insurance, 2% of that will go towards the pool that you mentioned that you were talking about. So we're looking at pooling the funds.
So this is working in tandem with private insurers in that case?
As well, yes. There's going to be.
So if you have, for example, if I have private insurance, 2% of my contribution to, or my payment towards my private insurer will go towards this pool.
Absolutely.
So I wouldn't have to change necessarily.
You don't
forced
have to
into
do any
NHI.
change.
My question wasn't answered. I mean, I was just trying to figure out what does that cover if I don't have insurance.
As I going back to my speech, the big change that we have made in the program is we're now introducing some high cost care. Those cancers, dialysis, the pacemaker, expanded the primary care. Though that is the standard package of benefits. Now for the high cost care, all the funds going towards that, including from the private insurance companies, are going into, I don't want to say national pool, because it's not going to be something that is gathered like government, but it's going to be in a pool agreed by all the insurers, and we will then consider the risk of each insurance company to that pool. Because you're going to have some insurance companies who are going to cherry pick and have the best and have the people. And then you're going to have some companies might have the people that are in the worst of care. We have a classical case of adverse selection. So for those who have more sick individuals, the pool will give them all their monies back. And for those who have more healthy individuals, the pools will take some more from them. That is the shared contribution that we make.
So will it include a cap then, based on what you just explained in terms of the cancers and all these other high cost ailments? Will there be a cap in there somewhere? As is common with most insurance coverage.
Well, I'd like to believe two things. That when you have the whole of a population into a pool, then you really don't have the issue of cap as such, because it means that everybody comes in. But number two, you also have to recognize that you can't pay for everything. There will be some cost of care that's going to be extremely high. So we're looking to have something of an ombudsman. Looking to have, in Britain they have what's called the NICE, it is the National Institute of Clinical Excellence. So you have a group of a panel of individuals, well expert in the field, that will consider what conditions can be afforded. Okay, so, and the third thing you can do when you have a pool like that, you can reinsure. And so therefore, you can determine exactly how much you're going to spend. So you can mute the issue of having a cap in that perspective.
Okay, thank you very much everyone for coming. That's all for today. As you're on your way out, we do have some refreshments and some fruit and cheese platter. Tammy over here is also going to be handing out copies of the policy paper. It's also available on the NHI Bahamas website. If you do have any further questions over the coming days, you can submit those to the contact information listed on the media advisory you would receive. Thank you very much for coming.